Welcome to our podcast, Advancing Health Equity Through Advocacy, Student Nurse Edition, where student nurse scholars are advancing health equity through the art of advocacy. As students and new nurses, advocating for patients and yourself can be difficult. Through this podcast series, our nursing student scholars will introduce you to experts and advocates in the field of nursing that can help highlight ways that you can make an impact on our maternal health crisis and on the health of the communities we serve.
Hi everyone, and welcome to our podcast today. I am your host, Izamar Favela, a Bass Scholar student nurse at UTMB School of Nursing. Today I'm joined by my co-host, Sunny Duong, a fellow Bass Nursing Scholar student.
Hi everyone. On this episode, we will be discussing maternal health inequities, why it matters. Today we are joined by our guest, Dr. Latia Hickerson. Dr. Hickerson, thank you for joining us.
Thank you so much for having me here. It's such an honor to be with you both today.
Alrighty, to get us started today, can you tell us a little bit about yourself and the work you're currently doing in the advocacy for maternal health equity space for nursing?
Sure. Well, I have the honor of having been a registered nurse for about 15 years now, and I've specialized in community health. I've been a women's health nurse practitioner for 11 of those years, and I have the honor of working with women in different stages of life. But what I enjoy the most is when I get to work with pregnant women, when I get to work with women in terms of helping them optimize their fertility in preparation for pregnancy, helping them to have healthy pregnancies and healthy postpartum periods. I also have a background in public health. So I have a master's of public health in maternal and child health. So that gives me the skill set to really look at populations as a whole and to see patterns and learn how to identify and create programs to address those issues. And then I have a background in research. So my PhD background has given me the tool set to be able to actually research those areas.
Thank you for the work that you do and taking the time to be here with us today. So let's dive into our question. Our first question today is actually what you believe in health equity means and why it should matter to nurses in the healthcare team.
Yeah, so health equity, when I think about it, I think about the various factors that influence a person's ability to obtain just and fair health. And so we all have our own individual factors, our own personal factors, genetic components. We have social components, economic drivers, social drivers, and these are called social determinants of health. And these are all factors that really impact our ability to obtain health. And so when we're looking at health equity, we want to try to create a scenario in which everyone has an individualized approach to get them to where they need to be. So I like to think of it as if, let's imagine the three of us are standing in front of a fence, a brick fence, looking at a football game. And I'm taller than the two of you, right? So I can see the football game without any problem. But one person may be a little bit shorter, so you're struggling to see the game. And someone else might be shorter, but also standing like in a puddle. And so you're really struggling to see the game. With health equity, we're looking at those factors that impact your ability to see the game and giving you a box that's personalized to you so that you can see the game, essentially. And this is important for nurses because we're positioned very uniquely in the healthcare system to look at the whole scope of someone's health and to be able to individually address those areas.
I love that illustration you just made. I love pictures, and just seeing the whole picture like that makes me understand it as a student. So why do you think you have a unique perspective on maternal health equity?
Yeah. So in addition to just what I see as a clinical provider, I get to see and hear a lot of stories from my patients. But then I also have the perspective of living my life as a Black woman in America and having to navigate the healthcare system for my personal health, for my 2 previous pregnancies and deliveries, my current pregnancy now, and just seeing my friends and my family have to also go through those same type of navigations and struggles. So I think it's given me a very different perspective in addition to wearing that provider hat as well.
So like you mentioned, you are pregnant, and congratulations.
Thank you.
Do you mind sharing your perspective on what maternal health inequities may look like in practice?
I don't mind at all.
So to expand on more on that question, have you ever witnessed a clinical care situation in which you perceive that the care provided by your patient or someone you know was influenced by their race, their gender, religious affiliation, sex orientation, or ethnicity? If so, can you provide an example at your comfort level for us today?
Yes, I'm happy to. Unfortunately, happy to, because I have seen this happen before. One example that I can think of off the top of my head, I have a colleague whose daughter just had a baby, and it's very common practice in the obstetric world to have the patient undergo what's called a urine drug screen during the pregnancy or right before delivery to just make sure that there aren't any exposures to drugs that need to be identified. And her urine drug screen came back negative. In this scenario, the nurse did not believe the patient, and so the drug screen was also done on the baby, and it came back positive. The doctor was notified. The doctor quickly said, "No, I think this is a false positive," but the nurse was very adamant and got CPS involved, and it's caused a lot of confusion and a lot of complications with this individual having to really navigate and show Child Protective Services that she is a fit mother to have her child. And I think in this nurse's background, she was just used to Black Americans having positive urine drug screens, so it was a difficult scenario for her to see something a little bit different. Another example I can think of is actually a personal example. And so I mentioned that I identify as Black American. But like many people from descendants of slaves, we are very multicultural. And so we have African descent, we have European descent, Hispanic, Indigenous American descent, very multicultural, but identify as Black. So when my son, my 7-year-old, when he was about 2 months, we had to take him to the hospital because he was having some odd eye movement pattern. So the pediatrician said, just take him in. Let's be on the safe side. Let's rule out seizures. And when the care team came in to do rounds, they started talking about their differential diagnoses. And that's really just a list of all the things that we think could be going wrong that's contributing to the scenario or the symptoms that the patient is having. And one of the differentials was that he could be albinism, that he had albinism, or that he was an albino. And my son has blonde hair and blue eyes. And I was really taken aback because it never occurred to me that there was anything different or strange about that, because I also had blonde hair and blue eyes as a child. But no one ever asked us about our race or our ethnicity. It was just an assumption that was made. And because he didn't look the way a Black boy should look, it allowed for assumptions to be placed into his care plan. So that was a really eye-opening experience for us.
Yeah. Well, thank you for sharing those stories with us. I'm sure they're going to be really helpful for our listeners. And so I want to add a little bit more so our listeners can learn more. The best scholars have learned about implicit and unconscious bias throughout our scholars program. But can you explain what it means to you?
Yeah, thank you. I'm so excited to hear that you all are learning about concepts such as implicit bias. It's very important. When I think about implicit bias, I think about just preconceived thoughts and ideas, notions, things we may have been taught, things that have been informed by our experiences that impact our ability to engage with other people that are different from us. And it's not anything that we're doing on purpose. It's really implicit. It's something that's hidden, but it is influencing our interactions. And that can be a very dangerous thing in healthcare in any scenario if you're not aware that that's happening.
Well, thank you so much for that and for your wisdom in this topic. As we know, communication is a critical aspect of providing and receiving quality care. Can you provide some examples of scenarios in which women feel unheard?
Yes. Unfortunately, this is something that I see a lot in clinical practice. I'll have patients come and they'll say, wow, this is really the first time I felt like a provider has listened to me or that a provider has taken my concerns seriously. And it happens a lot more than I would like to see happen. So I'm so glad that you're bringing this up. I can think of two specific examples of that are very different, but can result in someone feeling unheard. One example is actually pertains to me with this pregnancy. And so when I had my first trimester ultrasound, to date the pregnancy, it was found that I had a small uterine fibroid. And uterine fibroids are unfortunately very common in Black women, 3 to 4 times more likely to have them than white women. And the technician, while I understand, is not responsible for explaining a diagnosis or going into detail, the manner in which it was done, it was just kind of like, we're scanning for baby. Oh, you have a fibroid. And then we just kind of kept moving. And so then I, being familiar with it, I kind of looked at the ultrasound. I said, is it intramural? I started asking questions. And she answered those questions, but there was not going to be any opportunity to talk about it. And then my care team from there on never mentioned it again. And so I think this happens often where the provider is used to seeing something. And so it's just not on the radar to just take the time to express empathy or to address concerns that someone may have. And it can result in someone feeling unheard, even if it's not even vocalized. Mm-hmm. Another example I can think of has to do with a dear friend of mine. Her name is Grace. Her name was Grace. She and I went to college together at the University of Florida. We graduated at the same time. We moved to Houston around the same time. We were planning our weddings and just the next stage of life. She got married a little before me, and so she and her husband were expecting their first baby. And her pregnancy, as far as I know, was going okay. I know she was seeing a high-risk provider under the advice of her mom, who had worked in OB for many years. So she had started developing headaches and swelling in her legs. And it was concerning enough for her to go to the hospital, right? So she goes to the emergency room. They don't really do anything. They just say, oh, this is so common in pregnancy. They send her home. She goes home and she's like, something is still not right. She goes back to the hospital. This time they gave her ibuprofen, but they didn't do any Doppler. They didn't do any lab tests, nothing. They sent her back home. She had an ultrasound. Her anatomy ultrasound was coming up that following Monday, so this was a weekend. And so she's just like, I'm going to wait until I go to my doctor's appointment. Unfortunately, she never made it to that doctor's appointment. She was in the car on her way to the ultrasound, and she collapsed in the car. She had blood clots. They found out she was actually pregnant with twins, so she was at higher risk for these blood clots, and she and her 2 babies died. But this shouldn't have happened. She went to the emergency room twice. She was trying to be an advocate for herself, and she was not taken seriously. Her concerns weren't heard. And this unfortunately happens way too often, where women are trying to express, they may not know exactly what's going on, but they know something is not right, but their interaction with the healthcare system does not yield them the results that they need to identify what's wrong.
Thank you so much for sharing that, Dr. Hickerson. I'm sure that was really hard for you to share with us today. I can see that communication is very important. So now to add more into this question, specific to perinatal care, what are some common communication challenges that occur between healthcare providers and patients?
Yes. I think there are several communication barriers that we could identify. I think one very common thing that we see, particularly once you get into various specialties in healthcare and medicine, is that from the provider standpoint, you get very used to seeing the same scenarios over and over again. And they may be very benign, they may be innocent, and so it can kind of cause a scenario in which you fail to look deeper to see what's going on because you're used to it not really being a concern. And that is something that we need to really be mindful of. While it may be something that the provider or the healthcare team sees over and over again very often, it's the first time that that person is encountering it, and to be able to do the due diligence of addressing their concern real time is very key. I think that we also have a lot of power differentials in healthcare. And so there are scenarios that are created in which patients may be made to feel that they can't question the authority of their provider or that they can't speak up for themselves. And in cases where someone may foster up the courage or the gumption to be a self-advocate, if you do that once and you're dismissed, then to be able to do it multiple times will probably be less likely. While there can be a lot of distrust in the healthcare system, a lot of times people trust the advice and opinion of their provider, even if it's going against what they may be feeling on the inside. And so really kind of working through those power dynamics, I think, are really key too. And then just remembering that a lot of times communication has to do with what's not being said. There are a lot of patients that cannot speak for themselves. And so it becomes our responsibility to be those advocates. I remember in nursing school, this is not OB related or perinatal related, but I had a pediatric rotation where there was about a 4 or 5 month old African-American baby, and she had her ears pierced. And that's a very common practice in the African-American community to have a child's ears pierced. But the nurse saw her ears and then lifted up her shirt and said, "Oh, I need to check and see if her belly button is pierced too." And I was so appalled by that comment. And I know that as nursing students, it can be a very complex situation when you're with your preceptor to really challenge their authority and their actions. But I made sure to say, this is a really common cultural practice for Black Americans, and it's not appropriate to address it that way. And I tried to educate. And so being able to kind of push forward in the midst of an uncomfortable situation and educate, I think is a key component of communication as well.
Yes, so just communicating what we need, and getting that individual care. So you said respectful maternity care. I do want you to just add more into that and just, provide examples. So an example that you may have you ever witnessed disrespectful maternity care, or can you provide a time when you witnessed it?
Yes. So once again, going back to nursing school, during my OB rotation, I witnessed what I would consider to be disrespectful maternity care. I had the honor of caring for a couple that were of Islamic faith, and part of their religious belief was that they could not have male providers participate in the birthing experience. The wife could not be exposed to male providers. And so they requested that the healthcare team be female only. And this was at a very prestigious hospital in New York City. And so in my mind, it should not have been an uncommon request to have this occur. But for some reason, everyone was really upset about this request. So every male provider that came in the office or into the exam room, the delivery room, labor room, they would come in, and then somebody would kind of lean over and whisper that they couldn't be here, and they would get offended, and they would make a comment about it, and they would look at the patient. They were really rude, and this just kept happening. They would come in and make these comments and leave, and it was making the family uncomfortable. It was making us uncomfortable. There was one point where either the resident or the OB took the birthing mirror that should have been used to help motivate the birther in the progress of the labor, she took that mirror and tilted it so she could see her own reflection and started fixing her hair. And it was just a really disrespectful scenario. They were completely disregarding the requests of the family. And at one point, one of the midwives said, this is not about you. This is about them, and making sure that we acknowledge their concerns and that we respect their wishes. And it still just continued. There was one point where they did an exam and they took the drape off, so the woman is fully exposed, and they didn't replace the drape. And as a nursing student, all I knew to do was to just grab the drape and cover her up. This lady literally didn't say a word throughout her entire labor. She was having an unmedicated childbirth. She said nothing. The only thing that I heard her say was she looked at me and she said, "Thank you." And you could tell she had tears welling up in her eyes. And yeah, it was just such an impactful moment in the midst of so much disrespect to be able to honor her in that way.
Well, that's amazing that you were able to do that for a patient. That's a goal. That's a goal for a new nurse. And, some of our listeners are going to be new nurses or nursing students, and I'm sure they would love more of your advice that you shared with us today. So when you think about respectful care, what advice would you give to a new nurse who is struggling with speaking up about difficult or uncomfortable encounter with a patient or a fellow staff member?
Yeah, I think that's such an important skill to master. And I think new nurses should remember that it will come with time. So give yourself just the honor of the time of growth and experience. Remember that we're all humans. We are all part of the human race. And so to just remember that we each have that element of humanity present, and that there's no hierarchy. No one is better or worse than anyone else. We're all on the same playing field, and being able to view everyone that way, I think, will help you be able to advocate when things aren't moving the way they should. I also think it's important to have self-reflection, some type of self-reflective process. So before I walk in to an exam room with a patient, I always just take a moment to kind of make sure that I'm centered and I regroup myself. From the hustle and bustle of the day, I think about whether or not I'm able to show up fully for this person. I think about if this person looks differently than I do. Are there any interactions or anything that I'm doing or that I may have thought of that is not fair to them because they're different from me? And just making sure that I'm being mindful of that. And so I think that's a really good practical tip for nurses to take, and being aware of how you would want your family member to be treated, and making sure that you're able to show that same thing to your patients.
So kind of like a short pause and thinking through it. Oh, I agree. Thank you for that answer. I know my listeners, and I appreciate hearing it from you and just all your wisdom today. Well, now to close off, we all know maternal mortality and morbidity rates are rising in our state, as well all over the country. We are the tangible ways nursing students and new nurses can contribute to reversing these trends.
Yes. Well, I first want to just applaud you and the BASS program and all the wonderful work that's being done, because I think that's an important first step, having these conversations. Having these conversations can be really difficult, but I think they're very necessary, especially when we're looking at the disparity of maternal mortality and morbidity in America and amongst Black women. And it's just really fascinating, because when we look at research and we can see the rates of women in other countries in Africa, their rates are very comparable to white women in America. But when they move to the United States, within 2 generations, we see that it's comparable to what the disproportionate numbers we see here. So having a very honest conversation about the experience of living in America for people of color and what that means for their health is important. Recognizing that there are differences, but even though we are different, we're the same, and finding those commonalities. And taking the time to really evaluate our implicit biases, evaluate how we approach scenarios that make us feel uncomfortable, how we approach scenarios that are different from what we're used to, I think is really, really key. But I think this, like I said, is the first big step in acknowledging that there is a problem. And it's much bigger than ethnicity and socioeconomic status and education. There are things within ourselves that we need to look at that are contributing to the problem.
Thank you, Dr. Hickerson, again for sharing your thoughts and ideas related to this crucial topic of maternal health inequities. We all really appreciate you sharing your time, expertise, and your very personal experiences with us. We hope this inspires nurses and future nurses to find their space in advocacy. For all our listeners, please join us for our next episode, Nursing Leaning In, Nursing Advocacy Through Community and Professional Collaborations, as we interview our guest, Dr. Shannon Stevenson from Emory University School of Nursing, who is a certified midwife, assistant professor, and nursing leader in maternal health advocacy.
Until next time, remember, you too can have a seat at the table and be the voice of change for mothers, babies, and our community now. The views and opinions expressed on our podcast are not necessarily the views of the University of Texas Medical Branch at Galveston Health System or the UTMB School of Nursing.